Okay, I'd like to thank Mike and Jantina for those fantastic reflections and thoughts on all of the talks and discussions that we had yesterday. I am here to chair the next session. If I can invite Mercury and Gabrielle or Gabby, do you want to come and grab a seat up here? Ready for the session. We are moving on to think about the impact of health research on climate change itself. Very briefly, for those who haven't met me, my name's Anna Cimento. I'm from the University of Edinburgh. And really, we're taking up in this particular session some of the points that Jantina actually was just speaking to, that question of we, as a research community, as a global health research community, we need to change in important ways, and really building on a number of the presentations from yesterday, which in various ways actually touched on the themes of the responsibilities of various actors in the research ecosystem to be accounting for or engaging with those climate harms caused when conducting health research itself. Specifically, these are raising important questions addressed at researchers. Okay. How ought researchers integrate sort of concern for those harms that health research has on the environment? It recognises the contributions that the health research process itself makes, whether via these very visible actions such as international travel, or the use of new technologies, to those more invisible harms as a result of the energy consumed, for example, to facilitate researchers in data storing or in processing or transferring temperature control vaccines or specimens. And the moral concerns here arise as a result of the well-illustrated connections that we went through yesterday between consumption, emissions, and climate-related health harms at the centre of the discussions over the past day. And health research has a particular moral interest in this problem because of the perverse cycle that exists between researchers aiming to improve human health, which leads to these climate harms that in fact lead to harms on health. And those in turn then drive up use of health services, which again is increasing emission use and continuing that cycle of ongoing harms. As Fortunate raised yesterday in her excellent opening keynote, this creates struggles and trade-offs in balancing those very immediate healthcare needs in front of us against those longer-term climate impacts. And as we also saw yesterday, particularly came to mind was the presentation from Gimel, we have to recognise the internationally dispersed nature of research itself across various actors, each with their own sets of interests, their own positions in relation to power, and their own priorities, which are being negotiated across different research. How should researchers engage in discussions to bring climate harms of health research to the table? What guidance and tools do we have to support these conversations to start from ethical premises? On top of this, we also, of course, have to recognise the environment in which researchers are working and accept the, at times, somewhat perverse incentives structures that we operate within. The publish or perish type narrative that also underpin the difficulties in potentially addressing some of these considerations. And it's into this complex picture that our two presenters today will be making interjections grounded in the responsibilities or the duties that researchers have to mitigate the climate impacts of the research that they are conducting. And to borrow from Jasna's introduction yesterday morning in the first session, here we are focusing very much on those human choices and human planning that have repercussions for the planet. They raise really complex collective action problems They are magnified in light of pressing current health priorities that disincentivize expanding the moral frame to incorporate distant others or future generations. And these questions of intra- and intergenerational justice are at the forefront of some of the presentations today. And they are underpinned by historically embedded structural injustices that also shape the distribution of health research resources, capacities, and infrastructures. Ultimately, the presenters speak to these questions of justice and how to think about addressing the costs and benefits that arise from health research and the practices that comprise health research conduct and lead to these climate harms. And just before I invite Gabby to come and speak, I want to also just offer a couple of brief reflections on actually putting together this session and this particular session within this forum. And that was that this theme was one that was reflected in the background paper and has been discussed in relation to healthcare practices more broadly, thinking about, ideas of sustainability in healthcare. However, in the abstracts that we received for this forum, there was only one paper, the one that you will hear today from Mercury, that actually spoke to this theme from a Global South perspective. And that really illustrates the significant gap in the literature and the thinking on this particular topic, exploring our ethical responsibilities as a global health research community in relation to some of these considerations. We did make significant efforts to explore the literature, to invite others who potentially could come and speak to us. In the end, we were able and lucky to be able to invite Gabrielle to come and speak to us, who is both active in this space and is also a co-author on Mercury's paper. So really speaking, we've got two presentations. The first from Gabby starts from this international perspective, and then we're moving to Mercury to think about a more kind of global South position in relation to some of these questions. And I wanted, finally, to just highlight this experience for how it fits into the broader theme that came up yesterday around the need for introspection, around the need for addressing our own ethical practices and thinking about getting our own house in order at this intersection between health research and climate change. So with that said, and that brief introduction, I will hand over to Gabby Samuel, who's going to speak to us for the first presentation. Okay.
Good morning, everyone. Well done for getting out of bed this morning. I struggled a lot with my jet lag. So I'm Gabby. I'm from King's College London in the UK, and most of my research explores the environmental impacts associated with health research and healthcare quite broadly. But today I'm going to be looking specifically at the environmental impacts that are associated with clinical trials, and particularly the responsibilities that are associated with climate harms and clinical trials. Clicker? Not working? Ah, yes. So the format of my talk is that I'll first introduce what the climate harms associated with clinical trials are. Then I'm going to presuppose that we have a moral obligation to reduce these climate harms. So I'm going to skip that bit over. Because there's debate around that, and I'm happy to come back to those in the questions. Then I'm going to say if we do have a moral obligation, then what are the responsibilities associated with that moral obligation? Then I will introduce the project that I've been working on to explore those responsibilities and finish up with some recommendations. I just want to flag that I've taken a huge amount of nuance and complexity out of my thinking in this talk, so I'm happy to kind of go into that more in the questions. So clinical trials are roughly between about 80 to 2,000 plus tons of carbon dioxide equivalent. So 80 tons is equivalent to driving a car 10 times around the planet. And obviously that will depend on the type of clinical trial, from whether it's very simple or whether it's very complex. And it also has other environmental harms that we must not forget. So hazardous and non-hazardous waste. But just to note that I am forgetting them for today because we're at a climate and health conference. But I do want to note why we've chosen this to be a climate and health conference and not an environment and health conference. And I think that requires some debate as well. So anyway, they have these harms, and every year more clinical trials are being placed on, being registered. So we really need to start to think about, do we need to address the environmental harms associated with clinical trials? So there's been quite a lot of work done in high-income countries that have explored how can we assess the carbon emissions associated with clinical trials, and where are the particular hotspots. And the particular hotspots come from, for example, travel is quite a big one. Patient participant testing is a big one, and the energy used in clinical research trials is quite a big one. And this is just an example of a process map of the Griffiths and colleagues, who have done quite a lot of work looking through the processes of clinical trials and where those hotspots are. And they argue that while there are these hotspots, each clinical trial is very specific and will have specific increases or decreases around those hotspots. But while there's been quite a lot of work done to assess the carbon emissions associated with clinical trials, there's been much less ethical focus on what moral obligations there are to reduce the climate harms. So for the purpose of this talk, I'm going to assume that there is a moral obligation to reduce climate harms based on the wide literature in the climate ethics, where there are a multitude of frameworks that can be used to say that we need to address these climate harms. But again, as I said, that needs to be open to debate and proper ethical scholarship. But to get to the point of responsibilities, I assume that, which leads to the question is, if there are moral obligations exist, whose responsibility is it to ensure that we address them? So in the climate ethics literature, most of the discussion, again open for debate, but I'm going to go with is around collective responsibilities. So this argues that there's a shared understanding of responsibilities, okay, and those responsibilities can be at an organizational level or at a community or a society level, but that those responsibilities are shared around a particular issue, in this case, climate change. And here I draw on the work of both political philosophy and sociology, which converge around this idea of being able to respond. So Marion Young argues that responsibilities should be attributed proportionally to ability. She's a political philosopher. Haraway, if there are any sociologists in the room, argues that we need to have the ability to respond, response able, to be able to do the response. So that leaves the question of which actors are best placed to reduce the emissions of clinical trials. So I draw on work from a WHO Commission project to develop globally applicable recommendations for trial mitigation. I'm not going to have time to go into the methodology, but please ask if you've got any questions. But we're currently speaking to a range of people across the globe that are associated with clinical trials to kind of get their reflections on how we can think about the climate emissions associated with them. We've spoken to 26 individuals, so up since we I submitted my slides to Adrian, from a wide variety of countries. And I'm going to point out 4 themes that I think are interesting in terms of responsibility. So the first, maximal preparedness. So this is talking about people that run clinical trials, so academics and industry. Now, they need to adhere, or they need the requirement of adherence to strict protocols to ensure trial efficacy, quality, and safety. And this is crucial for any clinical trial. And this is particularly crucial for regulatory trials, because the regulators are going to need to check or audit all of the clinical trial material to ensure that the I's are dotted and the T's are crossed. And this has led to this culture of nervousness and panic, where people are so worried that something will go wrong or there'll be a slight issue with the protocol that their clinical trial will be rejected or not be seen as rigorous. So it's led to trials being conducted with this idea of maximal preparedness, or even precaution or over-precaution, which has led to a huge number of site visits where those running the trials are having to travel to the site visit, to the site clinical trial sites, to check for compliance, to check that data entry is occurring as it should do, to check that the trial is up to scratch to actually conduct the clinical trial. So there have been moves to kind of reduce these visits based on economics, but also because it has the benefit of environmental impact. But this is really tricky because they're moving to cluster visits where you fly, visit lots of sites and fly back, but that's not always possible. And digital communications is also very difficult in low and middle income countries because of the issues with connectivity and the digital divide. Second point, responsibility is intersecting issues of capacity, trust, and colonialism. And when I spoke to a range of contributors on this project, there was just so much discourse that was screaming to me colonial discourses. So the issue is that many of the clinical research sites in low and middle income countries are perceived to or lack capacity, which means that the visits to these sites are very, very, very frequent. There's a lot of flying in between to check the compliance. Those running the trials talk about, it's my responsibility to make sure the trial's working. I need to go to the site. I need to check this. I need to check that. And there's also this flying of samples from the clinical site back to the host institution for the processing, because it's deemed that there's not sufficient processing on site, and flying engineers for broken machines. Examples were given of the machine just doesn't work anymore, the machine that's been shipped in for high-income countries, so they need to get an engineer just to come because they don't have local capacity to fix the machines. So there's a move to decentralize trials to increase capacity, but it's not easy because there's a lack of sub-zero sample storage, and also, as I said, the processing on site is seen as inferior to host labs, and there's this worry that if we don't get as much as we can out of the samples and out of the data, then we're wasting resources almost. So there's this real tricky balance between the need to verify correct trial conduct and building capacity and the co-benefits that come with that in terms of less flying and the decolonization of research. So now I'm going to talk about those that are actually at the clinical research site conducting the research. And for them, there was a real lack of responsibility. Okay? There was a whole reason for these. So one is that the facilities are often housed in large institutions, so they lack control over energy source. Another is those stringent protocols that I talked about, they have to follow them to the letter. So they really spoke about absolutely having no ability to maneuver, even if they wanted to bring in climate concerns. And they also spoke about needing to bid for contracts to conduct clinical trials, and these contracts didn't allow them to be incentivized to, for example, use more expensive low emissions, like technologies or practices. And then finally, although I think this probably should have gone first, the responsibility for getting it right first time. And I put that in inverted commas because there is a movement in the UK called Getting It Right First Time, which is all about conducting health research in healthcare with good quality so we don't have to repeat it. And the example that was given that I placed on the slide is really interesting because one of the contributors talked about how those leading and running trials were often using new diagnostics during trial conduct that were not standardized. And this meant that basically there's obstacles to generating reproducible and valid data and potentially waste resources and emissions. So in summary, I'm doing okay for time, I can slow down. Recommendation 1, a good trial, however we define good quality, another, time for another place, is a sustainable one. So here, Anna, don't comment on the fact that I've used the word sustainable here. We were having a discussion about it last night. So, but what I'm trying to get at here is sustainability, and I'm using that in knowing the complexity that comes with this term, shouldn't be seen as something that's external. In high-income countries, we always see it as an add-on, like we see ethics as an add-on. It is intrinsic to good quality. If we conduct something with good quality, it is likely to be in a sustainable way, in thinking about environmental harms, thinking about social justice issues. So therefore, I would argue that there's a responsibility on sponsors, on those running clinical trials, on funders, on journal journal editors, all of the ecosystem in that sense, to ensure that trials are well designed from the outset, appropriate research questions, no unnecessary duplication, well-designed methodology. And this is not new, right? We should be doing this anyway. So this is what I mean about if we do this properly in the beginning, then we're almost addressing many of the concerns that we have about carbon emissions. Second, resourcefulness. This is not something that I've spoken about earlier, but I really think this is quite important. So we know that safety is important. We know that quality is important. But what a number of people that were working at low and middle income country-based sites were talking about was that the mitigation of emissions was happening by accident because they just didn't have the resources. And I think there's something that high-income countries need to learn from what's happening in low and middle-income countries in terms of this idea of resourcefulness. I feel we've lost that in high-income countries, where we overconsume and we don't think about the consequences of that. So I'd like to see a move or a shift from maximal preparedness to also include this idea of resourcefulness. I think there's a lot to be learned from that. And finally, co-benefits. So a co-benefit, as I'm sure you probably know, is when you have two policies and you implement one policy and you have a positive outcome which will have a positive outcome on another policy. So in this particular context, I'm thinking about this idea of capacity, right? So if we promote socially just, decolonized research processes through decentralized trials, then we're going to have the added benefit of also addressing carbon emissions. So therefore, that puts a responsibility on sponsors, on those, putting in proposals for clinical trials, on REC or IRB support to support investment in things like renewable energy, digital infrastructures and capabilities, skilling workers through decentralized trials. And in fact, we did speak to one REC member who said that capacity building was part of the ethical review. They wouldn't grant ethics approval unless there was some form of capacity building in the application. But then we spoke to another contributor that said they couldn't capacity build in a particular country because their funding didn't allow it, because they weren't in that stream of funding. So there's a lot of tensions that need to be resolved here. But I just want to finish just to say that co-benefits are not a solution. We need to not fall into, just as we heard about technological solutionism, a regulatory solutionism where we think co-benefits are going to solve the problem. They're not. They are uncertain. They are an uncertain process, and we need to constantly evaluate what do these co-benefits mean? Are we achieving those benefits? So just to give you an example, rebound effects are when you implement something to reduce carbon emissions, but you end up increasing them. And if we move to decentralized trials, are we likely to then move to more medicalization in low and middle income countries, which I'm not saying is wrong or right, but I'm taking it in a neutral way, which leads to more clinical trials, which leads to more carbon emissions. So when we start to think about these rebound effects, then there's more questions around responsibility, but I'm going to save that for another time, and I'm going to end there. Thanks very much.
Thanks very much, Gabby, for that initial talk. I'm going to ask you to hold questions. We're going to allow Mercury to speak, and then we will pick up questions for the kind of 15-minute discussion afterwards. So I would just like to now invite Mercury Shatindo to the stage to give us her talk. Thank you.
Good morning. Nice to be here today, and Gabi, thank you for setting the stage for my presentation. So today I'm just going to take us through some of the ethical considerations in data health research from the perspective of funders, researchers, and institutions. So, sorry, I have a clicker here, so I need to use it. So I have already given this introduction. So we will also consider how do we balance between a critical aspect of health research, between health priorities and environmental impacts and sustainability. I will also put a disclaimer that when I'm talking here, you'll see that I've used the word environmental sustainability, but I'm going to use this word interchangeably with climate change action, in line with also our theme for this particular forum. So what is the context of this particular research? As we know, Africa, as much as we are considered to be coming on the stage a bit late, we are actively and very aggressively catching up. That means that even as we are encountering different issues or health challenges, we are also using a lot of energy in this particular space. We are also utilizing a lot of data, and therefore we are also leaving carbon footprint in terms of digital infrastructure and also e-waste. So this growing adoption of data-intensive health research has environmental impacts. We wanted to understand how do the researchers who are in this particular field feel about this environmental sustainability, and what are some of the practices that we have in place that they are maybe practicing, or even if they're not practicing, what are they aware of that would help us be able to know how do we move forward in ensuring that we have the sustainability we want in terms of climate change. So we will go through different perspectives. We will focus on only 3 key findings. And apart from the 3 findings, just to let you know that there were very many findings, but we chose to focus on only 3 because of time, and wanted to be able to give as much depth as possible. We will also examine tensions between health priorities and environmental concerns, and explore some of the frameworks we can use to balance these competing needs and identify contextually appropriate solutions. Our methodology included qualitative design, which was in-depth interviews with the researchers in Kenya and Senegal, which included institutions and funders, with a focus on data-intensive health research. So some of the theoretical frameworks that we looked at that could help us be able to balance these needs, you will see how this comes into play when we get to the key findings, is environmental justice. This particular framework examines the unfair distribution of environmental burdens, and as you have heard from Gabi, she's in this space, and most of the work that they are doing with her co-authors involves how do you apply, how does it affect minorities or marginalized communities in an equal manner. So this framework looks at how can we ensure we have equal distribution of the benefits and burdens that come about from the environmental impacts. And when we do this, we are talking about the benefits and also the burdens. So you find that in most cases, most marginalized communities are the ones maybe who bear the greatest responsibility when it comes to burdens. And we see that there is a perpetuation of environmental inequalities when it comes to this distribution. And then our second theoretical framework combines 2 principles of responsibility. This is a Carney's hybrid model, where we have polluter pays principle and ability to pay. So this particular principle focuses on putting more responsibility to actors who are deemed to have created or contributed towards greater environmental degradation, and them being also having the ability to pay. So when we talk about ability to pay, we are talking about having the financial means and capabilities for you to be able to actually do something about the climate. And then when we talk about those who have created most environmental harms, we go back to historical contributions towards this. So there is an element of injustice whereby you find that you would look at it from the lens of that the countries or regions that have been able to contribute most towards the environmental degradation should be able to bear the greater responsibility. And most of the times you find that these same countries would be able to also have greater capacity to implement solutions. So we need to find, it focuses on a balance between responsibility and capability. And then our third framework is the Young's social connection model, which focuses more, it actually complements Carney's model, because Carney's model has also received a lot of criticism. So this model comes in to be able to complement it and maybe strengthen it, because it focuses on responsibility, which is based on capacity, and it does not consider the past. It does not focus on laying blame on anybody, but it posits that there is no one single actor who contributes to environmental degradation or impacts alone. We have multiple actors or activities that play a role for us to have the impacts we see right now. So it's not just about direct causation, and focuses on the systemic barriers or injustices that we have, and how can we improve the social structural connections. So it's a forward-looking responsibility which focuses mostly on collaborations and working together to come up with solutions. How do we apply this? We have seen that there's a focus on network connections, like the way we are here. How can we work together to be able to come up with solutions that going forward can be able to help in reducing some of these impacts on our environment? And there's also a focus on shared but differentiated obligations. This means that even if we are playing a role towards reducing some of these impacts, the role is actually based on our capabilities as well, our capacity. So we cannot come to the table and say, since we are coming up with solutions. Time is up already? Thank you. Since we're coming up with solutions, all of us, we cannot also say that we have the same capacities. So I might be coming with I might be coming with a particular financial muscle. It can be expertise or something else, but we are coming together to come up with solutions that can be able to help us create frameworks that would work. So let's now delve into the key findings, which we found to be very interesting, even for myself. Since we'll not go through all of them, I'll just focus. We are focusing on only 3. The first one is competing priorities. This comment, I didn't honestly expect it, but it's the reality on the ground. Sick people don't care about the environment. So it's just as simple as that. So if you're coming to me and telling me, Mercury, would love for you to take care of your environment, you should do ABCD, I would tell you, why should I care about it and I'm not fine? So when you look at this in the face of resource constraints, then you would see that environmental concerns do not take a priority in most. We only did this for 2 countries. However, when you look at it from a wider lens, it represents most of what people feel from these particular regions, that health outcomes are prioritized over environmental concerns. And when you think about even priorities, if I am to buy, let's say, an equipment, would I consider the environmental impact it will have, or affordability, or its availability? So that is what I'm going to use to gauge what equipment I'm going to get. If we have a pandemic, we are not going to worry about the kind of equipment we are going to use when we are like treating patients, we will look at the health first. So when we have limited resources, we are also forced to make difficult choices. And sadly, or in reality, the choice is normally not the environment. It normally doesn't come as a first choice. So secondly, we talk about responsibility attribution. There are many, actually, let me not say many, but I would say that we had the notion that the Western nations are seen as the primary responsibility. When you hear somebody saying that I'm not concerned, it's not my problem, I'm not the cause. So I have removed agency from myself, and I'm making somebody else more responsible towards this. So we see that the Western nations are seen as the primary responsibility bearers. And you can see one of the comments, like, we are just consumers of these technologies. So we are not the ones who are creating some of these technologies, we are just consuming it. And because the institutions we spoke to said that they were storing their data out of Africa, externally, in big techs, it means they would say that they are therefore not contributing to the degradation of the environment. It's the tech companies now who bear that responsibility. So they remove the agency from themselves, and they consider the tech companies as the environmental custodians. So thirdly, we see the health environment nexus, where we see having a healthy community as a prerequisite for you to have an environmentally conscious people or population. So we need to be able to see how can we balance these approaches so that we ensure that we also have good health outcomes, so that we can also have a place to start to discuss, things or matters to do with climate sustainability. And how do we also consider the local context that shapes these priorities? Because you realize, depending on the local context, the needs or priorities might be different. We can say in conclusion, not concluding my slides, but just the findings, that the ethical implications that we saw were the misalignment of Western and African perspectives, the need for contextually appropriate frameworks, the balance between immediate and long-term sustainability, and then the question of fair responsibility contribution. So some of the recommendations that we came up with is just being able to develop context-sensitive frameworks. When you talk about developing context-sensitive frameworks, it's about some of the things we've already discussed yesterday. How do we include the communities? This should be led by researchers who come from LMICs, and being able to include the knowledge systems that exist within those localities, and just being able to integrate the local perspectives. Then, secondly, having a collective responsibility models as based on the frameworks. We should be able to focus on international collaboration with transparent accountability frameworks, and seeing how can we have shared but differentiated responsibilities. As we have seen, we all have different capacities and capabilities. So how can we work together to be able to come up with solutions? And lastly, in terms of recommendations, what are the practical ways in which we can implement this? One of the ways that came out of this particular study was incentive structures, which were felt like the organizations which do their best, like to do what is right for the environment, there is no sort of recognition. The recognition would just go to the tech companies that they store, like the servers, but then there is no local recognition of some of these practices that are already there. How do we build capacity, and how do we engage the tech companies so that we have partnerships and being able to have ways in which we can be able to facilitate, like having some of the infrastructures in place. How do we share in some of the solutions that we need? So lastly, this is my last slide, when we see the way forward, we just need to find a way of balancing these approaches. For institutions, how do you develop frameworks that are able to help in sustaining the environment? For funders, how do you enable sustainability practices? And for researchers, how do you ensure that the work that you do is good for the environment? And there is the importance of collective responsibility and continued call for research and dialogue. Thank you.
Thank you so much, Mercury. We have about 10 minutes, I think, for some questions. Yeah, encourage those of you who didn't get a chance yesterday perhaps to ask your questions. Please do put your hands up. Anand.
Thank you. That was a great session to get started this morning. Gabby, I was wondering if there were some tensions in your analysis around the whole idea of doing things right the first time versus reproducibility, because that's also a central tenet of science. The fact that we have a lot of questions around scientific integrity or research integrity, and sometimes trials, unless you run them again, that is one way to know if it was done properly the first time. Now, of course, that's very resource intensive. Funders don't want to fund repeat trials, but that's also something which happens a lot, especially in biomedical research, lab-based science. So how do you manage that kind of a divide? And the second thing is around the politics of funding, right? Why is it that funding, and we saw some data reflected yesterday as well, is largely still going to high-income countries, which are then sub-granting low-income countries, and which is where, again, a lot of this travel-related carbon offset that you talked about happens. So if you look at funding from NIH for global health, for example, it is still going largely to American universities who then sub-grant LMIC collaborators. But if it was the other way, then perhaps we would not have that kind of international travel built into the design of how funding is happening. So how do we hold funders accountable to some of that as well?
Okay, thanks so much for those questions. So I've got a bad memory, so I hope I remember the second one after I've done the first one. Yeah, I did write unnecessary duplication on the slides because I agree with you. So there is a tension there between we do need reproducibility even if we're working with quality. So I think the argument is I'm not saying that we shouldn't duplicate trials, but the unnecessarily duplication of, for example, poorly designed trials, because I think that's more of a concern, right, is that the trials are being conducted. I think someone estimated that like 85% of clinical trials is actually research waste because they weren't conducted in an appropriate fashion. So the getting it right first time, I don't think is saying that we shouldn't duplicate, to check or to change or to bring in context specificity, but more that we should spend more time planning the trial to begin with to get it right the first time, and then we move on from there. So. In terms of the politics of funding, yeah, completely. I was very, very shocked when we spoke to all our contributors. So we're doing this more of a co-design project, bringing them on as contributors, about the colonial language of this idea that, because when we spoke to people in high-income countries, there was just this idea that we're the ones running the trials, we're the ones that have got the funding, and everybody in low and middle-income countries, they can't get it right without us. They don't have capacity, and it really worried me. I was really taken back by it. But even when we spoke to those in low and middle-income countries, they were telling the same story. We don't have capacity. We have to follow their protocols. We are almost in debt to them who are coming over to fix our, our things and help us. So I think it's going both ways, this coloniality, and I do think that we need this tension, kind of this balance shifting towards putting more effort, and that's why I was kind of arguing we need more capacity building in low and middle income countries, and that comes from moving funding to those places. So I mean, I agree with you. I think that there's a lot of work to be done at that level to kind of address these challenges.
Thank you. Thank you.
Thank you. This is a question maybe for Mercury, but you can decide who wants to answer. So I work on data sharing quite a lot. So one of the ethical imperatives for data sharing is to reduce research waste. And from what you found, maybe that's not true. Can you? And I have been a real advocate of data sharing, so I'm a bit worried now. So could you comment on that, please, either of you?
Yeah, this is really interesting. When I conducted the interviews in the UK, a lot of the health researchers that I spoke to hadn't thought about environmental impacts before, but they spontaneously kind of came to this idea but it's okay because I'm doing open science. Oh my God, I'm being environmentally sustainable or whatever you want to call it, because open science allows the reuse of data, which therefore reduces the resource of having to collect that data in the first place. That's true, but it doesn't address the issue of the rebound effect, which is what I was talking about in my slides, which is if we have more data, and the more data we have, the more AI algorithms that we can run, and the more energy-intensive algorithms we can run. So we have become the society of data fetishism, that the more data we collect, the more we're going to be able to solve the solutions of the world, and that if we make all of that data openly and accessible, that would be even better, because we'll have more data to analyze with our big, powerful AI algorithms. And I'm not in... I want to critique it, but not say that it's not a good thing, because obviously we need data, but also reflect on what are we really trying to do here? I mean, we know what a lot of the issues are already. Okay, we know a lot of the issues supporting health are socially determined. We know what the issues to do with our planetary degradation are, which is overconsumption. So why don't we just stop trying to procrastinate by saying we don't have enough data? If we just make it open, we can run more algorithms and we can solve the problem. Let's go to policy action now. We know what the issues are. So in answer to your question, so I've gone to an advocacy role, it's a difficult balance. It's not, I don't think, it's a problematic co-benefit. So it seems like a co-benefit on the surface, but we need to evaluate over time to see if it remains a co-benefit. So I'm not answering your question, but that's how I would come at it. It's uncertain, which is... Does it help? Mercury, do you want to add anything?
I called, from the study that we had, the issues of data sharing are looked at differently from how Gabi looks at it. There are two ways. There is data sharing where people feel that they are forced to share their data, without really wanting to share their data, especially if you're dealing with the genomics data. And secondly, you find that people have removed the responsibility, like for e-waste, on themselves because they save this data, they store this data elsewhere. So it's not really their problem whatever happens after they have stored the data elsewhere. However, those are some of the notions that we need to build capacity on so that people can actually understand the effect of some of the practices that we currently do.
Hi. My question is to either of you. I hope I'm able to articulate what I'm trying to a complex thing I'm trying to convey. I think one of the main challenges we face in a lot of low and middle income countries is, of course, capacities. But now that some countries are getting to that capacity level, now there's the need to decarbonize and learn how to do new trials or research in a different way. So, and I'm going back to some work of what Amartya Sen, Jean Rees, and some other philosophers has done around development as justice. So I think one of the things I found missing in the entire justice power conversations was how getting developed in the sense of how it's seen in the majority of the world is in conflict with the need to decarbonize things, and I think it overlies also into the health research space. So I was thinking if you have any reflections on that.
Can I ask you just to hold that thought, because we're going to take one more question at the same time, and then I think we're going to need to wrap up the discussion to move into the breakout groups.
Hi both, excellent presentations, thanks so much. I guess building on some of the themes that have already come up, are there certain kinds of research that we would deem kind of not worth the climate emissions that they would cost? Or in the inverse, is there some minimum kind of knowledge standard that we'd expect a trial to generate that is then worthy of whatever percentage of climate, whatever percentage of carbon emissions we've decided the trial is going to cost? I hope that question makes sense, but just really trying to kind of think through, is it that just all research needs to reduce its climate, I was about to say carbon footprint, I'm not going to say that, its climate impact, or is there another way of looking at this as there are some trials that are just, to your point about research waste, are there some trials that are just not worth conducting in the first place?
Okay, do you want to go ahead?
So I will try to answer your question, and I hope I got it right, and then Gabi will take Marisha's question. So if I understood you correctly, you're asking if there is some conflict between the global standards and maybe the local standards of how we should be able to tackle environmental sustainability solutions. Is that the question?
Was it around the development? So how do we develop while we're trying to reduce carbon emissions?
No, what I was saying is the capacity and capabilities of research scientists in low and middle income countries in terms of achieving the global standards. There's always a deficit. Some countries have, and some scientists in all countries are now reaching those standards, and the standards change now because there's now the standard of decarbonization of doing research being additionally put in for planetary perspectives. And many of these countries or researchers are not the historical polluters of that way. So there's also that sense of justice around what Amartya Sen says, that development is a justice because individuals have the right to reach a certain standard they want to, which whatever way it is. So how does that fit into the conflict? Because there's a clear conflict happening about low and middle income countries now wanting to hold that standards, and what we are discussing here about the need for additional normatives being set. Yeah.
Thank you. I think I get it now. So from the frameworks which I presented, it's the reason why the focus was on those frameworks where you're looking at like Kani's model. It looks at the polluter pays principle, whereby the people who, or the countries which have played a key role in environmental degradation also play a greater responsibility. They have greater responsibility when it comes to the solutions. And then also you combine it with the other role where we are talking about that the person who has also a greater capacity to also, it doesn't mean that you played a role in polluting, but you just have a greater capacity in handling. The reason for this is at the end of the day, the environmental impacts affect all of us. It might not be an individual responsibility, but the fact is that you can get sick as an individual. So if we say that we are not going to do anything about it because Gabi is the one who did it, and maybe Gabi is not doing something about it, it means I'm going to get sick and die. So what can I do within the means, within my capacities, about where I am from, and how can I work with Gabby to come up with solutions that help all of us. So building capacities would help people get sensitized to be able to do what you can do from wherever you are. And the justice, when you look at the justice principle, it also shows that if you are the one, you should not, because you see what happens is that most marginalized communities or even LMICs maybe bear great responsibility, the burden, like, you know, where you have e-waste, you're the one maybe who has maybe that data center or something like that. How can we be able to reduce that? The only way you can do that is you come together, you have shared but differentiated responsibilities.
Thank you. So the question is almost around, it's a social value question as I think I understand it. So ought we start to be choosing or prioritizing climate health research versus other research? Are some clinical trials more worthy than other clinical trials, or do we just handle all research as equal as we think about decarbonizing research? I'm very wary of starting to place normative statements about what research is more worthy than other research, rather than saying that all research should, you know, decarbonize. But I do feel that, at least in the UK, at least, there have been quite a number of incentives over the last few years to get researchers to shift to looking at issues of climate. And while most of that has been around data, which is slightly problematic, I do think that's a shift in the right direction if we are to address the climate crisis. I just want to flag, I've been in this space for a while, and I do struggle with this question of, do researchers actually have a moral obligation to reduce the environmental impacts of their research, carbon emissions of their research? And I do believe that there is a moral obligation, but I really think this idea of capacity and ability is very important. And we've got to remember that health research and care, well, particularly health research, doesn't actually contribute to that many carbon emissions. And I don't think that means that we should appeal to worse problems, like that we have a clean slate and we shouldn't worry about it. Of course we should, and we should leave a legacy to other generations of how to conduct research in a resourcefulness way where we have considered those issues. But I don't think that we should get to the point where we're tying ourselves up in knots about this, right? We need to remember that climate change has been caused by those socio-political context above us. The idea of a carbon footprint emerged from the fossil fuel industry as a way to put individual responsibility upon us, to make us feel that it was our responsibility. As a sociologist, I argue that we need socio-political change to address these issues. And whilst we need to think about the way that we're reducing our carbon emissions and reducing the environmental impacts to address issues of environmental justice, to address issues of social justice, I think it's just part of kind of what we're trying to do anyway in terms of justice, and we just need to be careful about how far we go. So in answer to your question, no, I don't think that we should get to the stage where we're picking and choosing what social value clinical research has, clinical trials have, but more important, ensuring that the clinical trials that we conduct are of good quality, and get it that way. I hope that answers your question.
Thank you very much. If you could just, thank you to all of our people who asked questions. Apologies to those that we didn't get to. But if you could just join me in again thanking the presenters for 2 stimulating talks. And you can continue the discussions in your breakout groups. Thanks very much.